What if some of the most important advances in cancer treatment don't come from new drugs, but from seeing old ones differently? A recent report in April 9th, 2026 edition of Science highlights a critical shift in how we understand metastasis, the process responsible for most cancer deaths. It turns out, cancer cells often don't spread alone. They travel in circulating tumor cell clusters, cohesive groups that can be up to 100 times more efficient at forming new tumors than single cells. These clusters act like coordinated systems. They resist immune attack, survive the mechanical stress of blood flow, and recruit platelets and fibrin to form a protective cloak. But that dependence on cohesion may also be their vulnerability. One surprising candidate to exploit this is Digoxin, a decades-old heart medication. At the cellular level, Digoxin inhibits the sodium-potassium ATPase, a pump that maintains ionic gradients across the cell membrane. Those gradients are not just about electrophysiology. They help regulate cell adhesion and structural stability. When this balance is disrupted, the tight connections that hold tumor cells together begin to weaken. In early clinical work, Digoxin was shown to shrink circulating tumor cell clusters, not by killing the cancer cells directly, but by making it harder for them to remain bound as a group. And once separated, those cells are far more vulnerable, less able to survive the bloodstream, and less likely to seed metastases. And that opens the door to a different kind of therapy, not just new drugs, but familiar ones, repurposed to break the alliances that cancer depends on to spread.